Hello, Dr. Vikki Petersen here. I wanted to speak with you today about an interesting study that came out about opioid painkillers. These are prescription drugs that are highly addictive, as you've probably heard, because so many people have gone into rehab for addiction to these drugs or lost their lives due to these drugs. And while they're trying to be restricted more and more, I think the mechanism is something that we should learn about so that we're less at risk. So what this study just came out a few months ago, May 2016, looked at the fact that what these drugs do, and a really market statement was that morphine, which is in this category, used for only 5 days, increased a patient's pain response for months. So only 5 days of taking morphine increased how much pain the patient felt. They were at an increased pain level for months. So you might think, well, that's the opposite of what they're supposed to do. So what's going on? You have pain responsive cells in your body, particularly your spinal cord and your brain. And these particular drugs, what the opioids do is they increase that responsiveness of those pain cells, meaning you actually do feel pain more acutely, which is of course why you would reach for more and more of the drug, because it's not attenuating, it's not lessening the pain as it's designed to. Reading this study, I sort of harkened back to my days in college when I was a bit of a Midol consumer because I had really bad menstrual cramps. I was not yet a doctor, I hadn't figured that out. But at that time, I was actually prescribed codeine with Tylenol. It's very hard to study when you're taking codeine. So Midol had caffeine in it, so I could stay awake while getting some pain relief, which was better when you're pre-med. Anyway, I learned then in school the metabolic pathway that these drugs utilize, only to find out that while you would get a lessening right at the moment of taking the drug, you would actually get a rebound effect, and in my case the following month when the menstrual cycle occurred again, and the rebound effect would be more intense. So it kind of kept you as a customer, if you will. I remember being a little annoyed at that and glad I had gotten to the root cause of the problem. But the key is that the reason I brought this up today is not just the bad news of opioids, because we know they're dangerous, but a really great study was presented at the American Pain Society, and what they found was that, well, they looked at athletes at first, so they looked at more professional athletes, people who are highly athletic, and they found that their pain response, they basically got better from a pain interaction, whatever it was. They got really badly injured or they had a surgery or something like that. Their recovery time was so much better as an athlete. And what they started looking into then was people who were just active. They weren't necessarily, highly paid athletes or professional athletes, but people who were more active versus the more sedentary, and discovered that a benefit of movement, and they didn't just say exercise, they said movement, which I liked, meaning you're not having to, run 5 miles in order to achieve this, but even people who were moving, staying active in life, they had a much better pain response than those who were quite sedentary. Now we know exercise is good for us, but this is amazing because what it means is that as you're more active and doing some form of movement / exercise, you're making more natural anti-inflammatories such that you won't need as much medication and you'll be able to get away from medication a lot sooner, which is really key. And they found there was a protective response from exercise of up to 90 days of this increased anti-inflammatory effect. So not that you want to time, oh, I'm going to have surgery, let's be active for 9 days prior. You don't always know when such things are going to occur. But what it does say is being active on a daily basis or 4 to 5 times a week basis will really serve you well as far as your ability to handle pain and have you not have to go down this dangerous road of opioid medication should something crop up for you. You'd be able to get away from it and maybe use not so harsh a drug, and that's really key because we really have a problem with that in our country. So I thought you'd find this study to be interesting. Of course, we're all about root cause medicine, which is getting to the underlying problem of why is a symptom being created, getting to that root, not just masking it with a drug. And if your health is not the way you want it to be, please feel free to contact us. We are a destination clinic, so regardless of where you live, people come to see us from across the country and around the world, and we'd love to help you. Until next time, I wish you very good health.